Well, if you've had extreme back pain, you know exactly how debilitating it can be, but all too often patients are told the only hope in getting rid of the pain is surgery. Our next guest says that's not always the case. Dr. Rahim Rizadeh from Alvarado Hospital is here to tell us how we can avoid going under the knife. Welcome.
Thank you very much. Great.
Now, a lot of people, or the big question is prevention. How can you prevent from having common back pain in the first place?
Well, Greg, it's, you know, the best news about all this is you can avoid staying away from my operating room in a huge way. And the best way to do that is to strengthen your back. And I have a few pointers that I'd love to make in regard to how to stay away from back surgery. Number one is posture. So all the ligaments and tendons and all we have, they're connecting bone to bone and bone to muscle. If you're in an upright posture, it keeps it at its normal length. So whenever you bend down and you stoop over, it kind of goes in an awkward position. If it's in that position for a long period of time, it's going to actually cause more deformity in your spine. You're going to have back pain from it.
It's funny, as you say that, I kind of sit up a little bit straighter.
Of course, as we always do.
What else? I think we have a few tips. We have a full screen to show you. What else do we have?
So number one is the posture. Number two is aerobic exercising. So when you want to exercise, and what I see from a lot of patients, they say, well, you know, doctor, I'm running, I'm walking, but it's a deliberate amount. So when you do the life cycle, when you do elliptical machine, when you do the treadmill, you want to have a specific time frame that you're doing that 1 mile, 2 miles. So rather than doing a 3 mile in 45 minutes, give it yourself maybe 20 minutes. And then every day bring that down so you have a goal, and then bring it down so at least you're at that limit, and then take it down and down from that point.
So don't try and do too much.
Don't give yourself a goal. And then at least make yourself sweat.
Now, why is keeping your core strong so important?
Keeping your core strong is very important because what it does is it offloads. For example, when you keep your abdominal muscle strong or your back muscle strong, it offloads the amount of pressure that your spine feels. So when you're keeping the posture strong, it keeps you upright. And when that does, when you're in this position, it keeps the muscles surrounding your spine very strong, and that keeps the disc problems and the nerve problems, you know, far away from us as possible.
Now, you say there are some lower back exercises that you could do to keep the lower back strong. What are they?
Well, one of the best exercises you can do, even if you're sitting at home, is when you're laying on the floor and you're kind of doing the Superman exercise, where you're kind of doing the McKinsey, it's called, where you kind of bring your arms up and bring your legs up, and you can kind of feel the muscles burn a little bit. The second thing that what we do with our institution, it's through spine zone therapy, is what we're doing is you are on these Med-X machines where you are stabilizing the pelvis, stabilizing the rest of your body, and you're allowing the motion of your spine to be all bore through your spine. And that's an exact example of it right there, is where they're stabilizing the knees, stabilizing the pelvis, and you're bringing the back up and down, so all the force is going through your back muscles.
Okay, so not everybody has the Med-X machines, certainly at home. How long do you do the Superman for?
You can do
30 seconds, a minute?
If you can do 30 seconds or a minute, you probably could do 30 seconds a minute. But you know, the average person coming around, 15 seconds. So either you can do repetitive, where you're doing 10 times, few sets, or keep it constant for 10 seconds. And kept it 10 seconds, take a little break, and another 10 seconds thereafter.
And we were talking before the show, I was telling you, my dad is a chiropractor, and he's instilled into me from the time I was, you know, a little kid, that diet is incredibly important. And, you know, not only the health of your back and your spine, but your overall health. How important do you think diet plays a role in having back pain, or avoiding back pain, I should say?
I think diet has a great role in it. Even though there's not a direct correlation to weight and back pain, I think diet overall, and not only just by the mere health of your heart and lungs and your ability to eat well, but it affects your ability to exercise, how much you're exercising. You know, all carb diet is not great, all, you know, fat diet's not great, but balanced diet is very important for all facets of your health.
What about the mattress that you sleep on? A lot of people, you know, firm mattress or soft mattress, and is there any evidence that one is better than the other?
Well, I don't think there's any direct evidence that one is better than the other, but you know, I just recently heard, you know, if you're in a soft mattress, what happens is you're sleeping there all night and you are not moving all night because it's so soft, but then when you wake up in the morning, you'll have more back pain because you've kind of been in that position all night. So in a harder mattress, theoretically, maybe you're moving a little bit more, but again, these are hypotheses, and nobody has a proven fact of what's better or not.
When a lot of people have back pain, the first thing they do is they go to the pharmacy. They get the drugs, either over the counter or prescription? Good idea, bad idea?
Bad idea, Greg. I think the best idea is you got to stay away from meds. I think the medication is as safe as any medication can be. It's very dangerous as well because these potentially could be a habit-forming medication. So if you need to take a medication, an anti-inflammatory medicine, over-the-counter naproxen is fine, Motrin is fine. These sort of medicines, Celebrex are the new ones that we're using. These things work quite well. The problem is if you start taking more and more medicine, the tolerance goes up, so you're taking the narcotics and it keeps on going up, so you're kind of chasing your tail. So staying away from the medicine is absolutely the biggest thing we can promote.
All right, Dr. Ramin Rezadeh, thank you so much for coming in today. Some great information for a lot of people that are suffering out there and thinking about going under the knife, which
thank you very much.
You don't have to do. All right, thank you.
Perfect.
And for more information, just go to san diego6.com. San Diego Living is coming right back.